Creativity leads to thinking. Thinking provides knowledge. Knowledge makes you great. A very good morning to one and all present here on behalf of the Department of Periodontology. It's a great privilege to welcome you for this National Periodontist Day celebration. The National Periodontist Day is celebrated every year on 23rd February, and it marks and commemorates the registration of the Indian Society of Periodontology as a non-profitable organization in the year 1975. The primary aim of ISP is to focus on the scope of media and enable the spread of awareness and diligence about oral health care to promulgate good oral hygiene as a preventive measure against the spread of periodontal disease. Hence, we celebrate the National Periodontist Day. And this year is very special because it is the year of the Golden Jubilee of the Indian Society of Periodontology. So the ISP has completed 50 golden years, and we are indeed privileged this year to integrate with the ISP to celebrate this as a week-long celebration. So the theme we have chose is Beyond the Smile, Unveiling the Perio-Systemic Link. We have drafted a week-long program of doodle art, tabletop clinic, and online reel contest. I enjoy the bliss in welcoming our Chief Engineer, Mr. Balachandran sir. Please welcome you, sir. Sir has been a backbone for all our activities, and we are very privileged to have you with us today, sir. We are honored, and I have the privilege in welcoming our chief guest, Dr. Srinivasan sir, who is a renowned periodontist, and he's made a very valuable contribution to the role of periodontology. And indeed, it's a great privilege, sir, for you to take your time and be here with us. And piezo surgery is something which is very unexplored, and our interns as well as postgraduates are really honored and privileged, sir, for you to take your time to be with us, to share your knowledge, and also we are planning to have a video demonstration of cases of vertical ridge defects as well as Wilcodontics, which is periodontally accelerated orthodontics, and I'm sure it's going to be a very good exposure to all the students as well as for the postgraduates. We welcome you wholeheartedly, sir. We also welcome our director cum principal, who has always been an epitome of knowledge and has been a backbone for all our activities. My heartiest welcome to all our heads from the other departments, the teaching and non-teaching staffs. A special welcome to our AO sir. A welcome to the dutiful PGs who have been, who would be really benefited, and also a special welcome to the PGs from other colleges for attending this program. Hence, we joyously commemorate the National Periodontist Day in solidarity with Less Pain, More Gain. We have our guest speaker, Dr. Srinivasan sir, with a lecture on piezo surgery, followed by a live demo on cases of ridge augmentation, Wilcodontics, and vertical ridge defects. This year we have integrated with the ISP, and the first time we are integrating, and it's a privilege because we would be doing a lot of activities, and they have supported us by providing banners and also about 2,000 free samples of paste, which would be distributed to the public as an awareness motive. On 24th, we have planned a balloon rally, Rangoli competition, and a patient education to a minimum of 1,000 patients, and hence championing vibrant oral health care for all. Thank you, and welcome you all once again to this Periodontist Day program.
Who has been guiding us with his wisdom, his leadership, have have been instrumental in shaping our institution. With great respect, I invite Dr. Vijay V.K. sir to address the gathering.
Pleasant morning to all our present here. It's a day we came here, we gathered here to celebrate the National Periodontist Day. It's been done by the Periodontology Department under the leadership of Dr. Deepshika Soman ma'am. And on behalf of the college, I welcome our trustee and the Chief Engineer Dr. Balachandran sir. Thanks for this coming here. As he always says, ma'am said, he is the backbone of our college because he has done a lot to our college in and around in the time. He won't consider the time, but he will be always present whenever we call him, and he will be coming to the college and he will be gathering and he will be doing some of the helpful things to our college always. Even though we have plenty of colleges here, but as the backbone of the construction is what is going on in and around of the groups of institutions. Thanks for coming, sir. And my brother, Dr. Srinivasan, and he is my what I can say, he is my brother, but when I was doing my PG, he was my senior, and from that time, and right now we have crossed around 12 to 15 years of lifespan, and it is most of the years I have worked with him, and I have been his brother also in a family wise, and in the teacher wise, he used to always guide me, because as we do the piece of surgery, at the time when we are in Annamalai University, right now we call it the Kadalur Medical College and Dental College. So at the time when we did our PG, so there will be plenty of cases will be there. Cases go on Samadame cases minimum or Nalaki minimum 50 to 60 cases of cases will be in period department as well. Because we have plenty of cases of scalings. One case Punja, other case card kaila, 10 card kaila. So another case கொடுத்துக்கிட்டே இருப்பாங்க. If யாராவது ஒருத்தவங்க ஸ்டூடண்ட்ஸ் கடலை போட்டாங்கன்னா advanced 3+ calculus cases கொடுத்துருவாங்க. So likewise it was there. So it was a nice journey when we were in Annamalai University. So during my post graduation, at the time the implants was what we can say is a dream, because implant cases அப்படினா we cannot see the cases what they are doing, because it should be inside the implant clinic. We will be standing outside. Implant case பண்றாங்கன்னா யார் உள்ள அலோ பண்ணுவாங்க, உள்ள போய் அந்த இம்ப்ளான்ட் பார்க்கலாமான்ற ஒரு ட்ரீம்லாம் இருந்த காலங்கள்ல இருந்துச்சு அந்த டைம்ல. What I'm saying is 2006. So அப்போ வந்து we are the first to start the implant cases in the period department. அப்போ நானும் பிரதர் தான் we started the implant cases over there, because my short study was in implant. So with his guidance I did my implant also at that time. So after that we did many surgeries like what ma'am said, periodontal axial orthogenesis, orthodontics cases. So நான் நிறைய பண்ணிருக்கோம் with the help of ortho department at that time, with the leadership of Dr. Sigamani sir. He was the ex-dean of Annamalai University. So our cases are the periodontal axial orthogenesis, intrusive implantation cases, அப்புறம் as ma'am said orthodontics, இது எல்லாமே cases பண்ணிருக்கோம். So the same way we thought why not to call sir to give a small knowledge sharing of the piece of surgery, because nowadays in Kadalur Medical Dental College piece of surgeries they are doing left and right. I know that because it's always done by the Dr. Srinivasan sir, professor. So thanks for coming sir, all along the way from Kadalur. Because I want to put him as a periodontist after one person, we thought him to share, because even though right now laser and implants, nariya classes, nariya programs, nariya nadandhattu, but piece of surgery it's totally, as ma'am said, it's a buried one, velila theriyala. But some of the colleges are doing, but piece of surgeries they do for lots of the normal micromotor badala we use the piece of surgeries also. So we thought why not to make it as a program over here in the Periodontist Day. We thought of it. So it's happening here. Thanks for it, and thanks for the alumni team what is happening here. And I welcome all the postgraduates from the other colleges. Thanks for coming, and thanks to the head of the departments and the institution heads of the department, head of the institutions also they send you here. Thanks for it, and make use of this program. And if anything else, please question him, because he will be an answer. He will be a right person to answer what are the questions you ask. So please put some knowledge and please be attentive in the program what he is teaching. Thank you very much. Thanks for the
Immense pleasure and pride to welcome our resource faculty, Dr. Srinivasan sir. Welcome you sir. Sir has graduated from Annamalai University with his bachelor's degree in the year 2000 and his master's in periodontology in 2007 from the same university. Then sir earned his PhD in periodontics in the year 2019 from Annamalai University. Presently, he is working as a professor in Government Dental College, Kadalur. Sir has given many guest lectures in lot of dental colleges Indian Dental Association workshops, and in various conferences. Sir has successfully conducted hands-on training programs in piso surgeries and lasers. Like a feather on his cap, he has published 40 articles in national and international journals. The latest highlights are receiving the recipient of International Research Star Award at the International Congress in 2025 and Asia's Outstanding Research Award in Periodontology and Implantology on October 1st, 2023. In our personal opinion, Sir is a beautifying jewel to the dental community as a whole. He is going to produce thousands and thousands of efficient dentists during these years. On behalf of this gathering, I humbly and sincerely wish him to contribute much more to the dentistry. I gain lecture on this National Periodontist Day. May I request our Principal Sir, Dr. Vijay Sir, to felicitate our Honorable Chief Guest, Dr. Srinivasan Sir. I now request our Principal to felicitate Mr. Balachandran Sir.
Really, he deserves that actually. So, as he says, கொஞ்சம் old memories நான் போகிறேன். When we are doing our PG, first எனக்கு எப்படி பழக்கம்னா, he used to come with a seminar copy. அண்ணா வந்து நாளைக்கு செமினார் 1 வீக்ல செமினார் இதெல்லாம் பண்ணணும் அதெல்லாம் பண்ணணும். பொறுமையாக பண்ணலாம் அப்படின்னு அப்படியே பரபரப்பாக இருப்பாங்க. அந்த பரபரப்பு இன்னைக்கு கூட இருக்கு. தட் இஸ் வை கம் டு திஸ் ஸ்டேஜ் ஆக்சுவலி. எப்படியே ஏதாவது ஈவன் வி வாண்ட் டு ஆர்கனைஸ் அப்போல்லாம் வந்து ஜீவா டென்ட் இஸ் ஒன் ஆஃப் த ஃபேமஸ் ப்ரோக்ராம் when we are doing our PGs. So people used to come from Karnataka and all. அந்த ப்ரோக்ராம்லாம் கண்டக்ட் பண்ணோம்னா we used to give it to Vijay. ஏன்னா அவர்கிட்ட கொடுத்துட்டா it will be done 100% வந்து நாங்கள் ஃப்ரீயாக இருக்கலாம் அந்த மாதிரி. ஸோ இஸ் ஒன் ஆஃப் சச் பிரில்லியன்ட் கேரக்டர் ஆக்சுவலி. ஃபுல் ஃப்ரெஷ் எனர்ஜி. அவரை பார்த்தா எனக்கே எனர்ஜி வந்துருது. எனக்கு எனர்ஜி வந்துருச்சு அவரை பார்த்ததும். ஸோ அந்த மாதிரி ஃபுல் எனர்ஜியோட தான் எல்லா வேலையும் செய்வார். ஸோ இட் இஸ் வெரி வி ஆர் ஒர்க்கிங் டுகெதர் ஃபார் 4 years ஆக்சுவலி. 4 to 5 years. இட்ஸ் வெரி அன்ஃபார்ச்சுனேட் அப்போ அவர் கிளம்பும் போது. பட் இட்ஸ் வெரி ஃபார்ச்சுனேட் ஆக்சுவலி. நவ் ஐ கேன் see him standing in a very high position. So you are very lucky enough to got such a dean come director come principal. So give him a big clap because at this age he has achieved a lot actually. Okay. இப்போ சப்ஜெக்ட்டுக்கு என்னை பற்றி என்னென்னமோ பேசுனாங்க அதெல்லாம் மறந்துருங்க. அதெல்லாம் ஒன்றும் இல்லை. நானும் உங்களை மாதிரி ஆள் தான். ஓகே தமிழ்லையும் பேசலாம்ல? ஓகே ரைட் தென் நோ ப்ராப்ளம். எவ்ரி ஒன் அண்டர்ஸ்டாண்ட்ஸ் நோ? ஓகே சார். Let me know how many PGs are there here. UGs, interns, okay, maximum. So sometimes I'll go little basic, okay, so don't mind because those people has to understand because majority of the crowd is UGs, so I have to go little down. So நாடா பெரியவங்களை போய் ஜிண்டே வெட்டிஸை பற்றி பேசுகிறாரு இதெல்லாம் நமக்கு தெரியாதான்னு நீங்களே நினைக்காதீங்க. They should understand everything, okay? And let me make it clear that I'm not going to give you a guest lecture. I'm not going to do it anything because my aim is you should know something when you leave the hall. You should know something about piso surgery, for which you need to ask something so that I can answer it, okay? Let it be an interactive section more than a guest lecture, okay? So the topic itself tells less pain, more gain. What do you mean by it? Surgery nale everybody thinks that there is a traumatic procedure, so you will have more pain and the patient will be more apprehensive. Then what are the factors? PGs can tell what are the post-op complications you see in surgery. Whatever the surgery, maybe a periodontal, even a flap surgery or any bone bridge augmentation, implants. What are the factors can be anticipated? see, you open up your mind. This is not the exam. I'm not going to give you any marks, okay? And one more thing is, நம்ம சொன்னா ஏதாவது தப்பா நினைப்பாங்களா? அதெல்லாம் don't hesitate to answer anything, even if it is wrong, even if it is silly, no issues. But answer something. I need only the answer. Even if it is wrong, I don't mind it, but I need only the answer. What are the post-op complications? You can see. Pain. Then, okay, so the main thing is even the operator as well as the patient. Both are very apprehensive initially because operator side the patient shouldn't have any post-op complications. At the same time, patients will see that, check whether the dentist is doing a correct job. He shouldn't mess with us. Okay, that is the main issues in here. So I choose this topic, less pain, more gain, because this equipment is really what the title needs. Okay, and myself, romba introduction la kudutanga, I don't want to get it, but only thing is I will try to keep my thing as a Annamalai University than a government dental college, because நாங்க பிறந்தது வளர்ந்தது எல்லாம் அதுதான் தாய் வீடு மாதிரி எங்களுக்கு. அது இப்போ திடீர்னு புகுந்த வீட்டுக்கு போன்ற மாதிரி கவர்மெண்ட் காலேஜுக்கு போங்கன்றாங்க. பட் அடாப்ட் ஆக கொஞ்சம் நாள் ஆகும். பட் ஐ வில் பி வெரி ப்ரவுட் டு பி சேயிங் அஸ் ஏ அண்ணாமலை யூனிவர்சிட்டி. எங்கே போனாலும் that will be a magic actually. Annamalai University will be so many. இங்க கூட பாத்தீங்கன்னா டாக்டர் விக்னேஸ்வர் இருக்காரு. We will see once the Annamalai University வந்துட்டா டாக்டர் ரஞ்சித் சார், டாக்டர் விக்னேஷ் சார் எல்லாம் அப்படியே மேக்னெட் மாதிரி we will attract with each other. That is the main. And whenever I start my presentation, first slide always itself. People start to see why it's taking doesn't get that much goal you have. Try to leave the college and each and every students have try to work hard to this is one of the Carlos building people are they have enjoyed this building doesn't keep money that it is a necessity that we can improve the society. It teaches us how to care us in the society. It teaches us how to be friends together, follow up, all these things. Same way, class to okay? That is one condition. So, whenever you do your so for shaping of the bone or to do any rib split, if shaping of the bone, rib split, if I want to do it, it will be a Greek and Latin to the UGs actually. So whenever you do a flap surgery, you have to shape the bone so that the bone should be smooth. Or if you want to place the implant, you should have an adequate bone height and length. Okay, then only you can able to place the implant. Suppose if you have any insufficient bone width or any sharp margins of the tooth, initially what we used to do, we have a bone scrapers or a hand instrument. Actually, we will do the initially by doing extractions also, once the transalveolar extraction split actually we will do with chisel and direct patient. Now because of all evolution, the new equipments are coming. So same way here, when you want to smoothen the bone or something else, we will do it with the hand instruments. Now again, as the evolution, micromotor with the micromotor checking. For what you are using micromotor? Micromotor is useful. So periodontist for polishing or for prosthesis, all those things. Okay. Great disadvantage of this differs with the help of kilohertz. Okay, this is a mechanical method or the rotary instruments can be used. That is why you are damaging all the soft tissues and everything. Whereas magnetic and piezoelectric, you cannot able to damage it, but magnetic tip we are not using it just because of the tips. Okay, the tips will be so large because we get metal stab, very inconvenient to work. Then we switched on to piezoelectric system. So in 1981 itself, Oro et al. Discovered that the development of the technology of ultrasonic apparatus, a smaller size and easier regulation, will become more useful for alternative in bone surgery. 1981 they have predicted that piezoelectric is going to play a major role. So this is the thing. The main thing is it shows to reduce the risk of damage to neural and vascular. Okay, so the concept is it prevents the soft tissue injury. That is the main advantage of piezosurgery. So this is what I said is the piezoelectric effect. Once the electromagnetic field is applied, these are the crystals are quantum. Okay, these are the crystals are quantum. Once the electric field is added, mechanical stress will be formed. Because of this mechanical stress, it may compress and expand. These crystals will compress and expand. Due to that, the vibrations is carried to the tip, insertion tips. You have two types of piezo effect. One is direct and another one is indirect. Indirect is also nothing but continuation of direct piezo effect. Okay, but those are the latest advantages. So a mechanical stress is formed with the piezoelectric material because of the thing, and it generates the electricity. This electricity is carried as a vibrations. Once the electricity is carried, again it acts on the second step is once the electricity is carried, it again acts on the material. So a physical deformation is formed. Again a mechanical force is generated, and it is carried to the tip. Okay, the indirect effect is the latest advantage. It carries both the direct as well as the indirect effect. So this is how it compresses and expands. Okay, whenever you create an electric field, a mechanical stress is formed. Because of the mechanical stress, there may be compression and expansion of the crystals. Okay. These two are important factors of using a piezosurgery. What do you mean by cavitation and microstreaming? Have you heard about the term cavitation? What is it? Very good. The bubbles is formed. So, can you able to see it in the ultrasonic scale? So, even in ultrasonic also, the same concept. What is it actually cavitation? For PGs, if I want to explain clearly, cavitation is nothing but a bubble. We are using a water or saline while doing a vibrations. The vibration is carried to the tips, and the vibration is we have a spray of water. How many of you have done ultrasonic scaling using solar? How many of you have done ultrasonic scalings? Interns, I think most of the interns will be doing there. So what are the things you observe? பேசணுமா சாப்பிட்டாச்சு தான் கலையில திருப்பாய் கலையில தப்பு இல்லை வாய்ப்பு இருக்கும் அப்பப்போ கொஞ்சம் பேசலாம் தப்பு இல்லை கிளாஸில் சொல்லுங்க What are the things you observe? Okay, what is the difference you see in a hand scaling and ultrasonic scaling? How many interns are there? Interns, I think, யாரெல்லாம் பெரிய நல்ல மார்க் எடுத்தீங்க யாருமே எழுதிருக்க மாட்டீங்களே டூ கார்ட் ஃபர்ஸ்ட் மார்க் எனக்கு புரியும் அவங்க லீவ் சார் ஓகே ஸோ வாட் இஸ் த மெயின் டிஃப்ரென்ஸ் சும்மா சொல்லுங்க பிகாஸ் யூ ஆர் we also know that you people love to do only ultrasonic and compare to hand scaling இல்லையா ஃபைனலி என்ன hand scaling கொடுக்குறீங்கன்னு கேட்பீங்க சொல்லுங்க why you want to do ultrasonic time consuming okay உண்மையிலே அதுதான் ultrasonic பண்ணுறீங்க அது பண்ணுறீங்க கை வலிக்க பண்ணுறீங்க so whenever you do the ultrasonic you are able to see easily the blood everything can be washed up. அதை கவனிச்சிருக்கீங்களா நாளைக்கு போய் பண்ணும்போது அதை பாருங்கள் do the ultrasonic scaling, see the water sprays and everything, how it flushes the bleeding and everything so that it makes a your area very clean இல்லையா? Whereas hand scaling பண்ணி தொடும்போது sometimes you will have a profuse bleeding இருக்கும். So it will make you tough for you to do the scaling when compared to ultrasound. The same thing happens here. Okay. So what is the cavitation means? The spray of water or saline which it is coming is a bubble, okay, which forms a bubble. This bubble, once it gets touches to the bone surface, it will explode, implode or explode. Implode வந்து போகிறது, explode வந்து தெரியும். சரியா? Implode போய் கான்டாக்ட் ஆகுது, explode வந்து தெரியும். Once it goes and explodes to the bone, what happens is it flushes the blood surface. One. Our next thing is it causes a hemostasis on the bleeding. Why means because of the pressure, what happens is on the blood vessels level, it causes a vasoconstriction effect of the blood vessels, so that it promotes hemostasis. Second thing is, when doing a scaling or bone or anything else, you will have a bacterial cell wall. It will disrupt the bacterial cell wall. So mechanically as well as biochemically, it is favoring both the things. Mechanically, how it favors, you can able to do the bone surgery and everything, whatever the thing. Second thing is, it also disrupts the bacterial accumulation, promotes clot and everything, so that wound healing, it enhances wound healing faster. Okay, so that is why it is more important. Okay, so it prevents the bacterial growth and everything. Now cavitation to microstream will be a difference. Cavitation will form as a bubble. Okay, microstream you can able to see here. இப்போ வந்து see spray ஆகும்போது what happens is this will be a microstream சொல்லுவாங்க. Oval shape spiral வர ஆகும். ஓகேவா? Same as here the water spray or saline won't form as a bubble. It forms as a stream and it attaches to it detaches the cell wall. Okay. So the main advantage of using a piezo surgery here means suppose most of the thing we can able to use a saline, normal saline. You can mix it instead of using a normal saline, we can mix it with povidone iodine. What is the difference between using povidone iodine compared with the normal saline? PGs. என்கிட்ட இருக்கிற ப்ராப்ளம் இதுதான், நான் கேள்வி கேட்டுக்கிட்டே இருக்கேன். என்ன டிஃபரன்ஸ் தெரியுமா? Why you want to use povidone iodine? Whenever you are going to do a any surgery like implants or any bone surgeries, any regenerative therapy, why you are applying on the external surface povidone iodine? Why can't we apply saline, normal saline? More? Okay, very good. More potent, because when you use a normal saline, only pH only its difference. It won't favor for the microorganisms to accumulate. Whereas when you use a povidone, it acts as an antibacterial agent. Okay, it kills our bacteria certain effect it has been given, and it won't allow the bacteria to grow and come back to normal saline. That is why even if you want to do any bone surgery or something else, instead of using a normal saline, you can mix povidone iodine along with the normal saline, so you can give a antibacterial effect, you can disturb the bacterial wall, you can cleanly maintain the surgical site, so everything will be there. All these favors for what? இதெல்லாம் எதுக்கு யூஸ் ஆகும்? கேட்க மாட்டேங்குது. அது என்ன சாப்பிட்டு நல்லா பேசலாம். It enhances the wound healing. Okay, it enhances the wound healing. That is why you can use the povidone iodine along with saline. Okay, whenever you do a piece of surgery. Okay, we come for indications. Okay, the indications are these are the indications. Okay, for UG is concerned, I will go when you are doing. How many of you have seen flap surgery as done by PGs? Any interns who have assisted for PG cases? Any interns who have assisted PG cases in period? I think. கேள்வி கேட்க மாட்டேன். என்ன ப்ரொசீஜர் பண்ணிங்கன்னு மட்டும் சொல்லுங்க. What procedure you have assisted? நேரமாக கைத்துங்க. சொல்லு என்ன ப்ரொசீஜர்? flap. What I have observed in flap surgery? Suture. Okay, very good. So, here again. Okay. So happy to hear that. So when we can able to see the pure touch and the pure touch, they are trying to remove the soft tissue, necrosed soft tissues, and those things can be achieved with the help of piezo surgery. Okay. So they are done with the hand instrument, basic cures they are used to remove all the debridement and everything. Those things can be achieved with piezo surgery. And smoothing of surface, they have done the smoothing of the bone and everything. All these things can be done. Bone grafting means you can harvest a block graft or something else. So autogenous block graft can be achieved with the help of piezo surgery. Now even implant site preparation also, piezo surgical kit has come for implant placement also. And explantation means the extraction of the tooth. How you will extract the teeth with the help of piezo surgery. When you plan for any immediate implant placement, you can use this piezo term. Okay, you have an insert which you have insert in between the bone and the cementum so that it what happens? Okay, how the cementum and the bone is attached? PDA. So it detaches all the PDA surface, makes the tooth loosen so that you can easily remove it. Okay? So in the sinus lift procedure, I think when you have a deficient ridge at the maxillary, first molar, second molar, you can do sinus lift procedure. What do you mean by retrograde root canal preparation? Where you will do it? Retrograde. How many of you assisted for episectomies? Raise your hand. So what you will do in anyway you have studied in oral surgery, yeah? What will you do? Episectomy. You will cut the root end, remove all the inflamed tissues. Yeah? Those things can be achieved in the help of piezo surgery. And episectomy, cystectomy, extraction of anterior tooth, even that is also possible. As I say, you can create a gap between the tooth and the cementum, and orthodontic surgeries, which I am going to show you in the life surgical demo. Okay? PAOO. What is PAOO? Very good. Periodontally accelerated osteogenic orthodontics. Okay, initially it was called as Kartikatommy. Surgeons because something okay. So it was actually oral surgical procedure. Now it has been transferred to perio. Why? I will show you. Tell you later. Okay. So absolute contraindication is what are the contraindications which are for surgery? Is same contraindication for even the patient using a pacemaker. Somebody will say that patients with pacemakers is contraindicated. But nowadays the pacemaker has come with a shield-like technique. Yeah, now because these vibrations will disturb the cardiac rhythm of the pacemaker. Okay. Now it has come. These recent advanced pacemakers have come with a shield so that they are saying that it won't disturb the cardiac rhythm. So even that you have to check whether the type of pacemakers, or you have to get an opinion from the patient's physician. Okay. Otherwise, pacemakers also is not much contraindicated. So the advantage, it is a key role actually. Why you are choosing piezo surgery when compared to micromotor surgery? These are the key roles. Optimal vibration frequency in mineralized tissue. Okay, so that is what I said. You should have an optimal frequency so that the main thing is precise cutting will be there. When I say precise cutting, the balloon is correct. Okay. See, contra and piezo, what is the difference means? In piezo surgical tips, they have a marked tips like the perio probe. Okay. Suppose if you want to cut 2 mm, 2 mm marking will be there. 4 mm, 6 mm, and the markings increase on. So when you want to cut at 4 mm depth, you can able to cut the 4 mm depth. That is the desired cut you can do. Precise means, see, the diameter of the piezo surgical insert is very thin when compared to normal round one. So when you use a bone cutting bar or something else, the diameter of the bar is big when compared to piece of surgery tips. So what is the advantage of that? Because of that, you can conserve more amount of bone. Okay, so that is where piece of surgery plays a major role. And I say avoids excess temperature because of avoiding the overheating of bone. Necrosis won't be there, so that post-op wound healing will be highly limited. So precise wound healing, soft tissues are not harmed. Strength required to cut the hard tissue is less because and the vibration it's not like micromotor when you increase the speed so that you can increase the cut something. It is not like that. Okay, so and maximum surgical control because visually you can able to see it just because of the cavitation and microstreaming effect. The field is totally devoid of bloodless field. So when you say 100% is a micromotor blood field, you got 10 to 20% bleeding. Okay, so clearer surgery side. And direct visibility, when you have the surgical side is clean, direct visibility will be there. It is 3 times more powerful than conventional coverage. Okay. Minimal intraoperative bleeding will be there, no thermal trauma to the bone and rapid bleeding. So all these advantages, when you have such a great advantages of doing these type of surgeries, then why can't we use this machine? Okay. Limitations, certain limitations are there. Adequate dexterity and gentle touch is required. Okay, it is a technique sensitive. Okay, there is a stimulated vibration. That vibration only you can able to give it. If you press more now, they won't give much vibration. So you should know to self-control the foot control speed. Okay, so the limitation is there. Increasing pressure will sometimes I think that when you increase the pressure, the vibrations also will increase and it will give good cutting efficiency. It was not like that. The best way is whenever you have increased the pressure, the speed should be very low. Otherwise, it will traumatize the bone. Increase in operating field because in micromotor when you increase the pressure, you can easily cut. But here you cannot able to do it. Okay, so it takes little time. Insert got wound, easily get got wound. Okay, it look like all are looking like ultrasonic skeleton tips. So many designs of inserts are there. Okay, so all these things are there. And the main thing is cost effective. So it is little expensive when compared to micromotor, but now I think 1 to 1.5 lakhs per hour, which when we were doing our PG days, it was around 2.75 lakhs. SAT lakh matunda that time 2.75 lakhs is a big amount and expensive also. Now it comes around 1 to 1.5 lakhs range vandachi. Amount reduce ayichi, value reduce money value. So how does it look like? How many of you have seen the piece of surgery unit? PG is ella paathirukkinga. Physio dispenser paathirukkinga. Physio dispenser paathirukkinga. வரும்போதே நீங்கள் இம்ப்ளான்ட் என்ன வரீங்க physio dispenser பார்த்ததில்லைன்றீங்க. So more or less looks like a physio dispenser only. Okay, அதே மாதிரி வந்து hanging saline இந்த saline பட்டல தான் you can mix community also for better insert tips save as antis and peristaltic pump so that the saline will splash. Okay, so these are the instruments. So variety and n number of inserts are available now. Okay, எல்லாமே நம்மளால வாங்க முடியாது. Depending upon our usage only we can choose the tips. When you see depending upon the procedures you have with tips. Sinus lift technique, okay, lateral approach, crestal approach, implant site preparation, ridge expansion, ridge flip technique, and periosteum preparation also to preserve the periosteum and for extractions. See, even for third molar extraction you have a specific tips. Explantation for extraction, bone block grafting, bone chip for preparing the bone chip, and endodontic tips, osteotomy, close to nerves. Endodontic tips are nothing but ultrasonic files like ultrasonic files. And corticotomy technique, periodontal surgery, for even for, as I say, curettage, all those things you can use as tips, and for crown preparation. Okay, coming for the biological effect, okay? Two technique I will show you. One is micromotor, another one is piezo, okay? So when we come for a biological technique, I have told you so many advantages for piezoelectric when compared with biological technique. So why actually, it enhances wound healing, wound healing coming. So what could be the reason? As a postgraduate, okay, I have to insist on it, okay, because see, when you are going out as a UG, no one cares about it. But when you go into as a PG, that reflects a lot. Okay? So PG should have a real concern about knowing the procedure. Clinical, okay, these are the effects and all those things are being there. Histological or biochemical, what are the things are happening, why there is enhanced wound healing in piezo when compared to micromotor. You should know not only for this piezo surgery, for all the things, even after doing a flap surgery, what are the things, any mechanisms there, you should have know the basic understanding of the basic knowledge of your surgery. Other than students. So, when you are a PG student, you should know all those things. So, you should be much mindful. 3 years, PG when you stay, you are a periodontists, you should know how to do each and every procedure. Even a periodontist plastic surgery, maybe you may lack in training, but you should know the technique and what are the things are going to happen. You should definitely know. Okay, so you should be very much careful about it. Okay, so there is a biological effect difference. What happens in micromotor? When you do a cutting with a micromotor or gross periodontitis, whatever may be, you cannot, the graft or bone layer. How many of you have heard about the block graft? What do you mean by block? Have you heard about block graft? Where are you using it? Very good. So what are the defects? What are the classification of each defect? Anyone knows? Simon's classification. Class is in the class 1 is buccocoronal defect, class 2 is epicocoronal, class 3 is both buccocoronal and epicocoronal. Okay, so whenever you talk about the rich defect, where you have to place, why you want to do a block graft? Because whenever there is a rich defect is there, you want to place a implant. In such cases, you cannot be able to place implants because so you need to augment the ridge. How you will augment the ridge? You will obtain a block graft. Where you can obtain the block graft? Graft symphysis, parasymphysis region, posterior mandible ramus level. So yeah, okay. So out of the way now. Anyway, so when you use this micromotor, what happens when you obtain a block graft? That graft won't be much viable to take up because due to overheating of the material machine, there may be, it destroys the osteocytes. Okay, maybe there may be absence of osteocytes will be there, because of that non-vital bone will be more compared to the vital bone. Due to which what happens? The graft won't take, the chance of morbidity of the graft is more in conventional when compared to piezo, because absence of osteocytes will be there and there will be predominance of non-vital bone will be there. Okay? So when you have piezo surgery, it causes reduced bleeding on the piezo sites. So what happens? Because of those things, due to decrease in heat and reduced bleeding, there will be more of, what do you mean by BMP? Bone manufacturing protein. Where it is used? How it is produced? Autologous, you can recruit from even unit. Have you heard about PRF? What is it? Platelet rich fibril. So you have more number of platelet rich fibril where you can attain even the BMP also can be attained, and TGF beta 2 non-osteogenic. These are the pro-inflammatory cytokines which are more in blood graft, which will help for regeneration of the bone. Okay, and more favorable osseous repair and remodeling when compared to carbon bones. Okay, so these authors have quoted those things. So whenever you do a osteotomy procedure with the piezo surgery, it decreases the risk of bone fracture, making bones more elastic after osteotomy with ultrasonic intermediate dilation. You understand this thing? Whenever you do with a piezo surgery, it prevents the bone fracture. So when you do with a micron, more chances for minute fractures in bone can occur. Whereas piezo surgery can be avoided. At the same time, it causes more elasticity of the bone, so more bone regeneration. It favors for more bone regeneration. According to Robielli et al., it acts only on mineralized structure, thus it will not contain or damage the soft tissues, which we have seen. Because why? Why it doesn't contain the soft tissues? First slide is I have talked about some frequency. What is it? So the frequency was around 20 to 25 only. So if it is more than 50 kHz, it will damage the soft tissue. Okay? So healing, according to the author's calculator, the average time of surgery, it takes more time compared to conventional because it is slow and more specific and slow. Okay? At the same time, the swelling and stiffness are reduced much. So post-op complications are reduced highly in piezo surgery when compared to conventional. Okay, we see those things are there. Now we have seen what is the physics which lies in piezo surgery and what are the advantages, disadvantages, what is the mechanism which is underlying in the surgery, what are the cells which plays a major role, all those things we have seen. Now we see the procedures. What are the procedures we have seen in piezo surgery? Okay, 1 second. Answer. Option 1 எடுத்துக்கிறதா 2 எடுத்துக்கிறதா? You decide. அதுக்கும் சொல்ல மாட்டேங்க. ஏதாவது ஒரு பதில் சொல்லணும்பா. Okay, PGs. What are the indications? What are the procedures you can see in piezo? How many of you எந்தெந்த காலேஜ்ல இருக்கீங்க? Ramakrishna Sir. Have you seen any piezo surgeries? பார்த்துருக்கீங்க. யூனிட் இருக்குல்ல காலேஜில்? யூனிட் பார்த்துருக்கீங்களா? ஏன் ட்ரை பண்ணுங்க. பார்க்குறதுலேயே பரவசம் இருக்குன்னு சார் சொல்லுங்களா? பண்ணுறத விட பார்க்கறதுல பரவசம் இருக்குன்னு சொல்றீங்களா? அப்படிதானே? இனிமேல் தான் பண்ணணும். சரி. So what are the procedures you can do in piezo surgery? Okay, implant site preparation. See, day-to-day practice you can do piezo surgery. Root planing, okay, root planing for bone grinding, intraoral defect, bone blending, bone that you can do it. Whenever you are doing a resective surgery, you can do a piezo surgery. Okay, we have to use the strategy. Okay, piezo surgery na implant block graft just think it out in this procedure how you can implement our piezo surgery device. அப்படி யோசிச்சீங்கன்னா நிறைய டெக்னிக் வரும். I'm showing so many cases. Okay. So initially if you see perio in piezo, sorry, piezo in perio, என்னென்னலாம் பண்ணலாம்? As I say, scaling and root planing, curettage, which because of the tips which are available now. Initially, piezo surgery is meant only for hard tissue procedures. Now specific tissues are available even for soft tissue procedures for using a curettage. Okay. என்னடா இவ்வளோ நேரம் வந்து சாஃப்ட் டிஷ்யூ டேமேஜ் பண்ணது சாஃப்ட் டிஷ்யூ டேமேஜ் பண்ணாதுன்னு சொல்லிட்டு எடுத்தது பியூரோடாக்ஸை காமிக்கிறாங்கன்னு பார்க்காங்க. புரியுதா? ஸோ ஸ்பெசிஃபிக் டிப்ஸ் ஆர் அவைலபிள் ஃபார் பியூரோடாக்ஸ் ப்ரொசீஜர் ஆல்சோ ஃபார் ஹார்வெஸ்டிங் பிளாக் கிராஃப்ட் ஹார்வெஸ்ட் பண்ணுறது. ஓகே, பெரியோடான்டல் சர்ஜரி, implant site preparation. What do you mean by ridge expansion? Ridge expansion then where you use ridge expansion technique? What do you mean by rich split technique? What is it? Flap மட்டும்தான் சார் பண்ண முடியும். அதை தாண்டி வேறு எதுவும் யோசிக்க மாட்டேன் சார். அதுதான் சொல்லுங்க. What do you mean by rich split technique? Whenever if you want to place an implant on a deficient ridge, I told you now, suppose if you want minimal diameter of the implant 3 to 3.5. Suppose if you have 2 to 2.5 ridge only, you can do a rich split technique. After you have to cut at the mid crystal level, you have to cut the, which bone is so hard? Cartilage. Okay, that will be the alveolar crest. And 2 to 3 millimeters after, you will have a cancerous bone. Very good. So you have to do a rich split by cutting the, you are giving by giving a mid crystal incision. You have to give so that you will cut the cortex bone alone. Then do the implant site preparation so that like osteodensification, slowly the which will get expand. You can expand till 0.5 to 1 millimeter. Okay, okay. So for which you can do a rich expansion technique, that is rich split technique. Then PMO, have you heard of distraction osteogenesis? It is totally one surgery. So vertical augmentation of the bone is distraction osteogenesis and crown lengthening. How many of you have done crown lengthening? Crown lengthening is தெரியுமா? யாரோ கை தூக்குனாங்க. தைரியமா தூக்குங்க. I love to see those who are raising their hands. ஏன் தெரியுமா? நீங்க தான் தூக்குங்க. கவலைப்படாதீங்க. சொல்லுங்க என்ன பண்ணுவீங்க? Crown lengthening with osteotomy. Osseous reduction. Okay, so என்ன பண்ணுவீங்க? So how will you place the flap after that? Will you place the flap in its original position? And then okay. So give her a big hand actually. I'm so happy. Okay. Can we use lasers in crown lengthening? Yes or no? Where? How will you use osteotomy? Only for soft tissue you can use lasers. Okay, so if it is a gingivectomy you can do laser. When you will find the gingivectomy alone is sufficient for crown lengthening. That's a topic of the video. So you have an adequate biologic width. You can have. Okay, I don't want to go much into it. Okay, so all these things you should learn. But okay, my intention is go now, at least now go and see what are the things which I have taught. Okay, go through these things also. Okay, what is mean by crown lengthening? I will get a techniques here. Okay, why you want to do gingivectomy? Why you want to do epithelial displaced flap? Why you want to do osteotomy? For scaling and root training, as I say, you have ultrasound is a standing exam. So curettage, I told already there is a specific tip is available to do the curettage. The main thing is microcauterization occurs. Okay, because of the laser technique, the because microcauterization occurs, it won't provides an environment for the microorganisms to grow there, and you have to do a thorough saline wash along with antibiotic approach and use பண்ணீங்கன்னா it will keep the area clean and there won't be further accumulation of bacteria. Okay, periodontal surgery. Okay, as I said now, when you do a periodontal surgery, you do a bone filing with these tips, percussion defect smooth பண்ணுறது with these tips. Okay, and interdental. So you have specific tips are there to smoothen the bone. Okay, either do a resective or reconstructive surgery. Whatever the surgeries for smoothing of the bone, different types of inserts are available where you can use the bone surgery along with the inserts. As you said, crown lengthening, osteoplasty பண்ணும்போது you have to deflect the flap, do the osteoplasty with the help of a piece of surgery and then replace it epithelially. Okay, harvesting bone graft. How will you harvest? told now, me and Vijay sir only, actually we were the first to do the block graft in our department at 2006 actually, I think, like 2006 or 7. So we did a retractmentation procedure by using nothing but we have obtained we don't have the screws, we don't have the instrument also. We did in first case we did with micromotor only. So what the thing is, we have to reflect the flap of the lower anterior surface. We have to take rule of 5. Have you heard about the rule of 5? What do you mean by rule of 5? Any guess? To obtain a block graft, you have to obtain a block graft from the parasymphysis region. So 5 millimeters below the apical foramen of the lower incisors and 5 millimeters away from the mental foramen and 5 millimeters away from the inferior bottom of the mandible. Okay, you should be thorough in it. Okay, rule of 5. So you have to obtain a block graft with the help of a piece of surgery. Just obtain the block graft and then inserted with the secured with the screws. Okay. After that, you have to place the bone graft and everything. Okay. So, what is the main difference between the conventional and the piezo surgery? Means when you obtain a block graft or what do you mean by particulate bone grafts? What do you mean by particulate bone graft? Is it autogenous bone graft? Autogenous or allogenous? Autogenous, allogenous thing. So particulate bone graft is nothing but when you are obtaining a block graft, you have to make it into small pieces, okay? So that you can able to mix it with the bone graft and place it on the defect comfortably. When you have a, see, these type of graft are required for managing the block graft ridge defect, okay? If you want a particulate bone graft, you can easily obtain it. When you have an intraoral defect in 6 or 7, okay? Suppose if the adjacent the bone is viable, 4, 5 another bone is there, you can obtain a small pieces of bone graft from that and then you mix it with the graft. And then what is the advantage of mixing autogenous graft and placing it on the defect? What is the main advantage? It has osteogenic potential, so more chances of bone regeneration will be available. That is what I told you. Device, if you have a device, try to infuse the device in the procedures what we are doing regularly. You cannot wait for to get a block graft to piece of don't make that strategy, okay? Whenever you have a huge defect, try to use the piece of device and obtain a small block graft or something else, whatever you are achieving it, just try to observe it so that you make use of the device regularly, it will become a routine pattern for you. That's why we have been, actually that's why we have been trained. Actually we won't have a normal cases and all. Even if we know that is a case which won't take it up now, we will try to do it because this is an institution where we can do all attempts. Okay, nobody is going to pursue you unless or until you traumatize the patient. Okay, so patient concern is more important. At the same time, you should learn the techniques. Okay, so these are in the procedure. Just make a strategy. How can we use the include the device into that procedure in the thing. So what is the conventional bone? It's a small particle size only you will observe because when you trim itself, most of the bone will be chipped off. So easily it will resolve. Whereas in a specific particle size can be obtained in piezo surgery. Around minimum 500 mm you can able to obtain it. Minimal resorption and fewer complication. Okay. And nowadays, as I told, implant site preparation instruments are all available. These are the, see, once you have to split the ridge with the help of these type of inserts and then try to do the site preparation with the help of this type of inserts. The main advantage of the implant preparation again is because of this vibration, minimal bleeding will be there, less speed production. So more more chances of wound healing will be faster and more chances of success rate will be there. The only drawback is, can you able to guess what is the drawback? What drawback can we add here? One is time consuming. Other thing is proper adaptation of the implant. See, implant companies have come with the implant and the implant drill bits designed according to the implant size. Okay, when you use this type of drill bits, you should be initially you find it difficult to engage your implant. Okay, then once you have got all those things depending upon the bone type D1 or D2, D3, D4, you can basically use it. D3 and D4 it is little easy when compared to D1 and D2. Okay, you know D1, D2, D3, D4 and that. think that's all. So these are the advantages of using a physiosurgery in implant surgery. You can obtain a block graft, you can obtain a chips of blood, distraction osteogenesis. All these things I have already talked about. Okay. So in the clinical picture, you can able to see with the help of the physiosurgery tips, you can able to do the implant site preparation. And you can place the implants also. This is done with implants. How many of you have heard about the sinus lift procedure? Please. What do you mean by sinus lift procedure? Have you heard about sinus lift procedure? Another. Insufficient amount of bone is available on the implant side due to expansion of the sinus floor of the alveolar resorption of the alveolar ridge. You have sinus lift. You need to increase the volume. Okay, do you know when you want to do a direct or when you want to indirect? Any idea? What do you mean by indirect? Okay, so give me a bit. Okay, so the thing is, suppose alveolar margin level, sinus floor, if you have only 3 to 5 millimeters available bone now, you have to do direct sinus lift procedure. Whereas if the available bone length is around 5 to 7 millimeters, you can try indirect sinus lift procedure. Okay, I will show you more. So direct sinus lift procedure is otherwise known as lateral window technique. Okay. See, this is the lateral window technique. You have to reflect a flap. Say up to this much you will have a bone. Okay. Then from here you will have a sinus floor. So you have to extend the bone till this level. So you have to increase around 4 to 5 millimeters bone height. What you have to do? You have to create a window with the help of a physiosurgery. Okay. Then you have to push it. Push it. Can you able to see? You are able to push it and place some grafts here. Wait for 2-3 months. Then do a implant site preparation. Okay. This can be done only when there is 3 to 5 millimeters length is available. Whereas here, if you have 5 to 7 millimeters length is available, what you have to do is you have to lift this membrane. What is the membrane which is available? Schneider membrane. What is the advantage of Schneider membrane? The advantage of Schneider membrane is even if you traumatize 3 to 5 millimeters or even more, you can able to heal automatically. So adnala membrane attack pannittom bleeding agudala bayapad. Nothing will happen. We are not going to do an extensive surgery. We are doing a very gentle surgery and pushing only 3 to 5 millimeters of membrane. Okay, the pushing you have to do it gently. You have to do it. Okay, so don't worry about traumatizing the membrane as surgery. Okay, even if you traumatize, nothing will happen. Okay, it has a good healing capacity that it will heal by itself. Okay. So don't worry about the complications and everything. Just make your mind that you are doing this, you can do it. But the only thing is, technically you should know how to do it. You should be with thorough knowledge about the procedure and do it precisely. Okay? So these things you should get. Indirect sinus through the crust itself. Can you able to see? இது வந்து osteotomy preparation பண்ணிட்டு then with the help of an instrument you have to push the Schindler membrane. You have lifted the Schindler membrane. You can able to see இங்க இருக்க membrane you can able to lift to here and then you have to place a bone graft. Simultaneously you can place the implants. That is the advantage of doing a indirect sinus lift procedure. Simultaneous placement of implants can be done. Okay. Sinus floor procedure is one of type. Somebody I told the rib split technique initially. So this is what is the rib split technique. You have a thin bridging. So yeah, for which can you able to say I have given a cut. If possible, today's case I will show you how to do the rib split. Okay. See, you have to split the ribs. Okay. The concept is you should go cortex la பண்ணும்போது தான் you will feel little resistant. The tips once and the resistance structure உள்ள வந்துச்சுனா you can able to recognize it that you have gone to the cancellous. Okay, you have to split the cortex around because cancellous easily can able to expand it when by doing the threading of the implant. Okay, so this is the rib split technique. And periodontally accelerated osteogenic orthodontics. Why you want to do this? What is the indication? Any orthodontist? What is the indication? எல்லா கேஸுக்கும் indication. Whatever the cases who are going for base fixing, you can do it. The main thing is you are accelerating you are fastening the movement of the tooth by giving a cuts on the alveolar bone so that if you give the force easily the tooth can be pulled. Around 1 year for a treatment plan 6 months. Suppose if you want to shorten the treatment span of the orthodontic treatment, then you can do a PAO. The disadvantage, more chances for root dehiscence, precision, more chances are there. That is why indicated cases to what is the indicated cases? Suppose the orthodontist feels the tooth is not moving because of the thickness of the alveolar bone. Illa nalla fibers attachment thick irukku. And the cases la it's not immediate. Suppose the patient is going to abroad, he wants to finish it off in 6 months time, you can attend it, nothing wrong with it. Okay, that is the periodontally accelerated osteogenic orthodontics. Okay, so this is the technique. You have to reflect the flap and give the vertical cuts. Can you able to see? The idea is if you give the vertical cuts, when you give the forces, the bulkiness of the bone is reduced, so the force is same amount of the force due to reduction in the bulkiness of the bone. It enhances more tooth movement. Okay, tooth movement, ortho tooth movement, they are not going to increase the force on anything. But the thing is, since the bulkiness of the bone is decreased, the teeth may easily move. And one more thing at the advantage, why I said initially I told you what is the difference between this procedure is initially called as corticotomy. Now it is called as PAO. Why? What is the difference that exists in it? Can anybody say? Suppose if you want to place the bone grafts, you can place the bone grafts here. Suppose if you feel the bone is so thin, easily the root dehiscence or all those things can be formed. You can place the bone grafts and then suture it. That is why it is called as period. And one more thing is you are periodontally accelerating because it is bodily movement. Okay, along with the tooth it is going, so you are periodontally accelerating the orthodontic movement. Okay, so that is why it is called as PAO. And the periimplantitis, as I say, like a curettage, even in periimplantitis you can do a curettage without troubling much on the bone as well as the implants. Okay, so it may not cause. What is the main criteria of doing main concern of doing what are the tips you use for periimplantitis treatment? Either you have to use plastic tips or titanium tips. Very good. Why you want to use it? Idea of doing that? it should not damage the implant surface, because implants are coated with so many plasma-spread, hydroxyapatite, so many things. But the main thing is you should not scratch the implants. If you done so, what will happen? More food accumulation and bacterial plaque attachment will be, it favors for more plaque accumulation. Okay? So for which, in order to avoid the scratches on the implant, you can use a plastic tips or titanium tips. Nowadays even lasers and ultrasonic tips also available. Ultrasonic tip won't damage the implant as well as the food. Okay? So the piece of surgery, see, it allows removal of calculus from titanium. And debris and infected bone can be removed from implant surface without damaging the implant. Okay? And it can also be beneficial in hard tissue as grown and screws lock. Sometimes the screws which you have fixed, sometimes debris can be accumulated along the screw. You may not be able to remove the screw from the implant. Okay? For which cases you can clean those regions with the help of piezo-surgery tips, and with the help of normal procedure you can remove the screws. Okay? So I will show you certain cases which we did in our department. Okay? So those things you may think that it is not a real indication. That is what I have told before itself. See, you should always try to adapt to the technique which you know in patient's mouth. Okay? You can't wait for cases to come. Available cases, try to make use of it. I will show you the case. You tell me the treatment plan. What do you see in this case? Which defect in which region? 3/6. Okay, so what is the patient has come for replacement and we have a ridge defect on the buccolingual direction where the patient wants specifically implant that you cannot be able to place the implants. Okay, now what is your idea? You just tell me. Which ear which ear? There is a dark person. Split or ridge expansion technique can be done. So what we have done is sit. Good. Give it a clap. So we did a ridge split along with the piezo-surgery unit. Okay. So the cortex, see, we have a cortex and the cancellous bone. The cortex within you should split the ridge so that you can have a little expansion of the ridge. Okay. Once the ridge split has been done, then the implants has been placed. Okay. So ridge split technique can be done with the help of these things. This case, tough case for orthography. As I said, no, so they find it very much difficult to recruit the first molar, actually first premolar. Find very much difficult to ask them what is your line of treatment. Just anyway, what can be done? First initial treatment, then you can do. Whenever you have, let me put it in another. Whenever you have a crowding, how will it be the clinical picture? Gingiva will be hard tissues, how will be the soft tissue parameters and the hard tissue parameters? Crowding no. How will be the marginal gingiva? Dish. Inflammation in the dish. Normal marginal gingiva will be scallop. When you see in crowding, how it will be? Loss of scalloping will be the one thing. Other thing is, how will be the buccal bone? So there will be thick buccal bone will be there in compared to liver. That is why it has been detected. So more bone deposition will be there. So when this patient has referred from ortho to say something, because this patient PG is not what they have all ortho PGs. We also learned from the building. Whenever my PG says, sir, the case can be Ramalala, and the case will need our put on the question, after this. So likewise, this case came actually. So initially, what can be done? So you have a thick tissue. Amrita, what treatment procedure can you do? Why you have a thick tissue in that? What will be there? Around the gingiva. How the teeth is attached with the help of fibers there. So you have a thick fibers around the tooth. So for which what you have to do initially? Very good. Precision. Okay, give her a big clap. Precision. So you initiated the precision treatment first. Okay, what is the ideology of doing a precision? You sever the periodontal ligament fibers and the gingival fibers. First, by severing the soft tissue, you will check whether the tooth is coming out or not. So 1 month we have waited. Again, the same scenario has continued. So what can be done next? Soft tissue you have then you have to do something with the bone. So what can be done in the bone? So what the thing is, you have a bulky bone on the buccal surface which is enhancing. So we don't want to reduce the bulkness, but we can give a 2 vertical cuts so that we separate the first premolar. Once the pressure can be given, it can be eliminated. Yeah. So what we have done is eliminated. See, with the help of a piece of surgery, we have given 2 vertical incisions and a bone graft to compensate the bone which we have diminished. We have placed the bone graft, see now, and after that, see. This is 2-3 months forward. Are you able to see? So this is how we have to do the surgery. So you have to implement the techniques which you need to go for it. Okay? This is another thing. So, what is this case? What does it tell? Again, the edentulous space. Third, I just check the third diagram and see what can be done. Third picture upon the breathe. What do you see in the third picture? Buccal defect. Okay, so you have a ridge defect. The buccal lingual width is diminished. See, initially we tried to place the implant because when we see the soft tissue parameters, we didn't find anything. Everything looks like normal. While palpating only, we can able to do those things. Every time we will do a CBCT, we will try to be able to find the defect. So, what is your line of treatment now? We'll just see. என்ன பண்ணலாம்? Bone graft. Okay. Will it hold that much amount of powder here? However, a cavity will it hold? Tell me the options. Okay, I accept bone graft. Bone graft, but 2 poduma. Along with membrane. Either you can go for even PRF also can be used. PRF, other bone graft mix again you can use the PRF as a membrane. You can close the defect. That is one option. What is the advantage of using a PRF? You have more growth factors, so it enhances more bone regeneration. Okay, very good. One thing is doing a block graft with PRF. Second, laser assisted Padala, but the thing is we need to augment the bone layer. So what can be done? Second thing is patient wants the replacement. So what can be done? Ridge augmentation. Okay. So you can do the ridge augmentation. What type of ridge augmentation you can do?
Where you will get the bone from augmenting the ratio? You need to get the bone from either from the ramus or parasympathesis region. Okay, that is the second option. Third one is that if you are more skilled enough, you can try to place the implant and the exposed threads can be filled up with the bone graft along with the PR. Okay, but my piece is it was very specific to do the black graft. அன்னைக்கு முடிவு பண்ணோம் நான் black graft ப்ரெசர் பண்ணி ஆகணும் அப்படின்ட்டு. ஏன்னா இம்ப்ளான்ட் பண்ணலாமே அப்படின்னு நோ சார் வில் டூ த black graft. நான் black graft பண்ணதில்லை. ஸோ we have attempted புரியுதுங்களா? ஸோ we have various options for any different. Okay, you have to choose it which one because little risky. இப்போ நான் வந்து if I do the implant with this patient, little risky. I have to take a chance. Suppose if I use the block graft and wait for 6 months and do the success rate will be very good. Okay, so we tried that. Okay, so see, just so I reflected the flap from carotid to carotid. I placed the incision and reflected the flap. Can you able to see the ramus region? Can you able to see the parasympathesis region? I am told to do rule of 5. You have to check it. Okay. See, these are the root abscesses. Okay. So I place the incision and the bigger about the first 5 millimeters and metal ball is somewhere around there. So I don't care about the metal from it because I'm taking it from the symphysis region. But always it is better to take it from the parasympathesis region because the symphysis is a little too thick when compared to parasympathesis region. Okay. So we have placed the two horizontal incision and connected with the two vertical incisions. Can you able to see? And we have removed the block graft. Okay. Now we have trimmed the block graft to adapt to this particular region. Okay. So now we have trimmed the block graft and placed in position and then sutured it, tucked it with the screws. And then the remaining areas we will fill it up with bone graft region. Okay, normal bone grafts and then suture. So this is one technique. Okay, so these are the things you have to apply clinically. What are the things can be there? One different one problem you can have 2-3 options. Okay, you need to choose it. Suppose if you have a favorable chance to use the piece of surgery for even a simple procedure, don't hesitate to use it. Try to use the device. Okay, then it will be easier for you to go for bigger cases. Okay, chinna case la try பண்ண it will be useful for you to go for bigger cases. Okay, how can we react? What you see in this? Actually, this is the failure cases. I tell you something. This is one of the failure. Enna paakkum? So sinus revitalization, they are able to see the complete no alveolar bone defect also. We tried sinusly, but we cannot able to achieve it. But I tell why we can't able to achieve it. So this is the sinus procedure. Can you able to see? I have created after reflecting the flap, I have created a window with the help of a piece of. This is where the piezo technique plays a major role when compared to microsurgery. See, in piezo technique, the incisions and all will be precise technique. Able to see that. So in the part, and able to see a precise cutting. Micromotor இந்த மாதிரி இருக்காது. ஒரு straight line cut வராது. கொஞ்சம் நீங்க ஷேக் ஆனாலும் and more amount of bone will be spared. See here, you can see the incision. The diameter of the incision will be around 0.5 to 1 mm. But when you use a micromotor, it will go around to 2 mm. At the same time, the depth, the desired depth will be 40 transfers over on the depth. That will even in micromotor. Here you can, because 4 mm depth we have to go deeper into the bone graft. 4 mm with the help of 4 mm only we will do it. Initially we make the bleeding parts and check how long it is going to the cancerous bone. Then we will continue the same thing with the other regions. Okay. So likewise, so this is the difference. When you do it in micromotor, it won't look like this. So what happens is we did the technique was good and everything we can able to achieve. Where we failed means we didn't have a block run. Sometimes here you have a maximum limitation of sinus. Okay, you need to lift minimum 5 to 7 millimeters. We have lifted it, we have placed the bone graft. What is the advantage of using a bone grafts? Synthetic bone grafts. We have mixed the bone graft along with the PRF membrane, but it is not quite sufficient to regenerate, reserve all the bone grafts because the space is so large. So what can be done? Correct. So block graft we failed to do that. Okay. So quite extensive procedure. Once we have created a video, we have to come here and take a block graft and then place it on our futures for people. We did one case actually along with advertisement, but I failed to include this case. So this doesn't work out for us. Okay. We have seen so many failures also, but never mind about it. The concern about this, you need to learn the technique. Okay. Try to expose for the technique. Tell to the patient that this doesn't work out, sir. So the place and everything looks good, and we are also very much happy actually after seeing the course of radiograph. But once after 3 months, if you see, we are seen with the CPCT again the same sort of bone was there. We cannot take 1 or 2 millimeters only we are gained actually. Now tell me what you are seeing in this. What can we see in this teeth? What are you appreciating when you see this case? Patient's complaint was swelling in the lower anterior ridge and first discharge was there. So what is your diagnosis now? Trauma to the teeth. Okay, so that what may happen? Trauma or whether to breakage, trauma means long before trauma. So what could be happen long before trauma? There may be periapical infection will be there. We also suspect the same thing, and our radiograph also shows the same thing. Initially, see, we attempted the exectomy in our anteriors. Okay, because this is trauma long before, and there was a crack in the tooth. And one more thing you have to appreciate. What do you see? The color of the tooth is slightly discolored. So we have opened and we can able to see the granulation tissues around the tooth. Once we removed all the granulation, the cavity was like this. Cavity suddenly I feel Sir, the block of paper is there. Flap or reflector bone machinery the block of so we are attempted to do that block graft. Okay, see here, we have obtained the block graft, but that block graft alone is not enough to fill the cavity. So we have taken the PRF along with the bone graft materials, everything has been practically done. So see, the block graft has been placed. By placing a block graft, you have to induce bleeding. Okay. So another bleeding points create. Why you want to do bleeding? For faster rated neovascularization. Okay. For enhance blood flow should be there. So placing the block graft, and then the PRF membrane can able to see the PRF membrane in the bone wax suture to the PRF membrane along with the bone grafts and the suture. Okay. So these type you should think differently to use the device and everything. Actually, this came out very well and it has been published actually in a good journal. Scopus and the PG is a very brilliant PG actually. She did a more extensive cases just so she published it. So 1 year before only this has been done actually. So these are the things which can change your treatment plan. Okay. Think smart enough to do all those things. Okay. So again, any questions? Questions at least now you know after 1 hour, either you understand everything or you understand nothing. Still chances in that. Do you have any questions to that? Okay, so next slide will be a good slide for everyone. Okay, so always, for youngsters, I always used to insist. Okay, வெளியே போகும்போது நம்ம என்ன பண்ண போகிறோம் அப்படிங்கிற ஒரு கோலோட போகணும். போய் have to work, really work hard for that goal. அது பண்ணிங்கன்னா டெஃபினெட்லி the goal நாம் எதை நோக்கி போகிறோமோ அது நம்ம போயிடும். ஆனால் நம்மளுடைய எஃபர்ட் வந்து சின்சியரிட்டியோட இருக்கும். நிறைய பேர் everyone will say ஃபஸ்ட்டு கேள்வியே பர்மிட் ஏன் வீடியோஸ் இருக்கு எத்தனை பேர் கேட்டாங்க எங்கள் வாழ்க்கையில் எத்தனை பேர் கேட்டாங்க கை தூக்குங்க எல்லாரும் ஆல்மோஸ்ட் இருக்கீங்க ஏன் வீடியோஸ் இருக்கு அப்படின்ட்டு ஓகேவா டோன்ட் ஃபீல் பேட் அபவுட் இட் யூ ஆர் சூசன் ஒன் ஆஃப் த குட் கோர்ஸ் ஒன்லி ஆல் த ஃபீல்ட் ஆர் காம்படிட்டிவ் நவடேஸ் ஓகே ஈவன் இன்ஜினியரிங்கில் போனால் அங்கே போய் அங்கேயும் யார் ஸோ மச் ஆஃப் ஹியூஜ் காம்படிஷன் இஸ் தேர் காம்படிஷன் இல்லாத ஃபீல்டு கிடையாது even if you go for medicine 80 colleges in Tamil Nadu medicine மட்டும் கரெக்டாக இருக்குது அது இன்னும் 5 years 10 years அது இருக்கும் so don't feel bad about choosing the profession okay make a goal and you should put a sincere effort to work on அடுத்தது பெரியோடிஸ்ட் பெரிய பிஜி சேர்ந்ததுன்னு கேட்டாங்க வேறு பிஜியே இல்லையா வந்ததுக்கு ஏன் பெரியோடிஸ்ட் அதான் சீப்பாக இருந்துச்சு அதனால் now see what are the things I have taught you today is totally different from Perio. Perio is flap and all. See, another one more game changer is there in Perio. Cardiac-based implants. I will challenge that only oral surgeons or periodontist only will do the cardiac-based implants. Also, they find it difficult because you have to put the implants 20 millimeter implant in the bone. So nowadays it is going to play a major role. Mark in 5 years basic implants is going to play a major role. So you have a big role to play actually. So don't get regret of doing a video. Okay, focus on flap value வச்சிருக்கீங்கன்னா நம்மளால எதை பற்றி யோசிக்க முடியாது டைவர்சிஃபிகேஷன் எல்லாத்தையும் பற்றி யோசிக்கணும் ஃப்ளாப் மட்டும்தான் பண்ணணும் ரீஜெனரேட்டிவ் மட்டும்தான் பண்ணணும்னா யூ won't get video cases. Okay, so have a great day and try to achieve that. Thank you. And once more, I would like to thank Dr. Vijay sir for giving me, Dr. Vijay and everyone for giving me such a wonderful opportunity. Okay? Thank you so much. And again, if you have anything to ask, you can ask from either from this side or from this side.
A round of applause because it's something where the undergraduates as well as postgraduates have not explored, and so that is why we also took this initiative from our side so that we could make our PGs as well as interns exposed to this. So just one question, sir. So if you are going to do a PGO surgery, is it that we have to use a bone graft mandatory or
not necessarily? Not necessarily, depending upon the cases which you are doing. I have told now for PAO, not necessary to do a bone graft, but if you feel that the buccal width of the bone is so thin, at that time it is better to place a bone graft in PAO. As I told, take the block graft. When doing a block graft, you will have sharp margins. Okay? Anyway, you will bend according to the donor size, you will trim there to place it. Here and there you have some spaces. Those things has to be filled with bone graft. Preferably if it is PRF, it is much more.
Yes, so I just wanted to know what is PRF done be routinely with piezo surgery because it would help in healing?
Definitely.
Can it be done?
Again, the things, individual's perception. When you feel that you can place a block graft along with the bone graft and PRF, you feel good, no hesitation, nothing wrong.
Are there studies, sir? Like
No, so many studies are there, but actually, when you place a block graft instead of a allograft, you can say that block graft plays a major role because it is an autogenous graft. And those things are filled with allograft materials, it acts as a scaffold for increasing the regeneration. And when you use the PRF, again it is more advantage. You have more growth factor, more morphogenic factors and growth factors, everything is there for which will aid in regeneration. So it is as I say, if you have chance to use a block graft along with the PRF, do it without any hesitation. That is good.
So any call on use of IPRF along with these procedures?
IPRF can be used as a local delivery. The main thing in IPRF, stability is not there. The advantage of doing IPRF is you can obtain it within the minimum rotation, within slow speed and slow minimum time you can obtain it. Then it can easily disintegrate. The thing of IPRF is when you place it in the subgingivally, it will try to attach the soft tissues to it can help the soft tissues there, and because of the IPRF, it growth factors like mainly regeneration, it acts as a local drug delivery. It means antibiotic effect. That's just the compared to regeneration. When you go for LPRF, it is better for regeneration than LPRF. But nothing wrong in using it. But if you use LPRF, that is good. Any other questions?
So you would interact because I think it's a very good opportunity for you to explore it and know your doubts. So we would encourage you all to just interact so that sir also feels that you've understood what he has spoken. I think sir made it very, very simple, very practical for all of you.
Yes.
The donor site will be left alone or you want to
You can leave it as such. Otherwise, you can place a bone wax. Nothing wrong. You can leave it as such. Nothing wrong. Because the thing is, they have obtained a bone graft. That is not an infected site. Okay? It is a good blood flow site. Where things can able to regenerate easily. When you do it in a peritoneal site, it is an infected. Fill it up with bone wax. No need of allografts at all because it's waste of money. Nothing wrong in placing the bone graft. The thing is, cost. It is not cost effective. Keep on adding it. I will explain all those things in case about each particular pair, what are the things you have to check and how you have to execute it. Okay. Idea is carry out with the idea and try to implement on your problem. Okay. Thank you so much for that.
As we come to the conclusion of our today's events, I would like to call upon Dr. Pradeepa ma'am to extend a heartfelt vote of thanks.
Gratitude is the fairest blossom that springs from the soul. I am honored to stand before you to express my gratitude for your presence and support today. First and foremost, I express my deepest gratitude to the Almighty for His blessings for making this day truly special and meaningful. With utmost respect and gratitude, I extend my heartfelt thanks to our beloved chairman, Dr. K.V. Kupusamy Ayya. Sir, your vision and leadership has been a guiding force for all of us. A special thanks to our esteemed chief guest, Speaker Dr. S. Srinivasan, BDS, MDS, PhD, Professor in Government Dental College and Hospital, Kadalur, for sharing his valuable thoughts. Your presence and insightful works have added immense value to this event, and we are truly honored, sir. I would also like to extend my heartfelt gratitude to our respected Principal Sir, Dr. Vijay E.K., for his continued support, encouragement, and guidance. I want to extend my thanks to the management and EVO sir for his support. On behalf of Department of Periodontology, I would like to thank all department HODs and other staff members for the solid support. We also appreciate each and everyone who has actively participated in all the events. Last but not the least, we would like to acknowledge the efforts of PGs, interns, final year and third year students. Finally, thank you all once again for being here and contributing to the success of today's event. Thank you all. Have a wonderful day ahead.